Minister of Health and Childcare, Dr. D.T. Mombeshwara, represented by UNAIDS, Mr. Jeremy Nyika, the Minister of Health and Childcare staff present, National AIDS Council staff, Civic Society, Kids Care, represented by Mr. Mackenzie, members of the media, ladies and gentlemen. Good afternoon. Good afternoon. Yes, so you will forgive me my voice projection. I'm just recovering from a bout of flu. Nonetheless, we are gathered here today at NAC headquarters to announce a special event. And I would like to thank the gentleman seated next to me, who is representing the guest of honor, for taking time and also accepting this role at a short notice. Thank you so much, Jeremiah. Yes, but before we start our program, I would really like all of us to stand up and observe a minute of silence in honor of Miss Due. We all know Miss Due. She passed away about 2 months ago, and as you all recall, Miss Due was pivotal to the commemoration of the World AIDS Day for a period of about 20 years. And her departure will remain a very difficult chapter in our lives and our work. So let's observe a moment of silence. Thank you so much. You may sit down. So let me again thank you, the media, for coming in your numbers. I mean, I'm actually impressed by the numbers. And you are then going to be able to send out a message there that we have a full week to commemorate one of the most devastating epidemics of our time and celebrate the great efforts which we have made over the past 2 decades in combating HIV and AIDS. So much so that it will no longer be a public health threat by 2030. Our theme this year, colleagues, will be unveiled by the guest of honor, but it resonates with the challenges which we are facing. The response to HIV and AIDS pandemic is multi-sectoral, and as we aim to close the tape and finish in the last mile, we are aware of the challenges ahead of us. We need to redefine and reshape the funding landscape. We need to look internally at the domestic resources to fund HIV and AIDS, and in particular, in health programs in general. And we are also at this stage where we are getting to the end of the Zimbabwe National AIDS Strategic Plan 4, which covers the period 2020 to 2025. At the moment, work is actually happening to develop this NASP 5, which will cover 2026 to 2030. And some of you consulted, and we really hope that this is NASP strategy. We have solutions to the issues which will make and which will end AIDS as a public health threat by 2030. But coming to this week, we have a lot of activities. It's not only 1 December where we commemorate the World AIDS Day. It's the whole week leading up to 1 December. So there are lots of activities which are lined up, culminating in the World AIDS Day commemorations in Umzingwane, Matabeleland South Province, on Monday, the 1st of December 2025. The reason why we are in Mat South is because the World AIDS Day every year, it's on a rotational basis, and this year it's in Mat South 10 to host, and in Mat South we also look at the district, which then hosts. I think the last time they were there, it was in Bedbridge. So we are in Umzingwane, but there are other activities which will happen, like a marathon, a half marathon, which will also happen, and a few other activities. Later on during the course of the year next year, we will then hold the provincial World AIDS Day commemorations. So at this stage, I also want to say that we try to combine 2 activities, ladies and gentlemen. You have to bear with us. National AIDS Council supports Paranyatua Hospital Ward A4 Special, which is a cancer ward for those who are familiar with Ward A4 Special for children. Most children suffer cancers of blood cancers, the leukemias, the lymphomas, but they also suffer from kidney cancers and cancers of the eye. So National AIDS Council procures medicines and laboratory diagnostics for the children through an organization called KidsCan. KidsCan. Every year we support that one. And Mr. Mackenzie there, we are honored that he's here with us today because we want to hand over a check so that they can continue with the work which they are doing in partnership with Paranyatua Hospital in the cancer ward, so to treat childhood cancers. So really, before I address the guest of honor to make a speech, I want to commend all of us for creating time to be here this afternoon at NAC as we kickstart these activities. I thank you. Right. So, just to let me here, so at this stage, maybe check after. Okay. So at this stage, colleagues, ladies and gentlemen, it is my singular honor really to invite the representative of the Minister of Health and Child Care, who was supposed to be the guest of honor in this meeting. Mr. Manika, may you please make your remarks. Thank you.
Good afternoon, members of the media, civil society organizations here present, and all stakeholders concerned in the HIV response. It is my singular honor to make these remarks, indeed, on behalf of the Minister of Health. I represent UNAIDS, the Joint Team on HIV and AIDS for the United Nations, and my country representative, Mr. Henry Damisoni, who is not here with us. He would have been happy to be here and to make these remarks. But nonetheless, I am here, and I hope that I'll be able to fit in his shoes to make those remarks. The National AIDS Council Chief Executive Officer, Dr. Bernard Madzima, and your team, the Executive Director of KidsCan, Mr. Mackenzie, senior government officials here present, the representatives from our development partners, members of the media, ladies and gentlemen. It is both an honor and a profound privilege for me as we gather to witness a pivotal moment at which our national response to HIV and AIDS directly extends a lifeline to another critical public health issue, the management of childhood cancer. This handover of a USD $109,000 support from the National AIDS Council to KidsCan is a strategic and compassionate investment in the health of our people, which represents a bold step towards integrating our health responses and ensuring that resources are leveraged for maximum impact on the lives of our children. As many of you are aware, people living with HIV have a significantly higher risk of developing certain types of cancer due to immune suppression, chronic inflammation, co-infection with cancer-causing viruses. It is therefore very befitting and worthwhile that the National AIDS Council is providing this support. Childhood cancer is a silent crisis which often does not make headlines. For many families, a diagnosis comes with not only the fear and heartbreak of a life-threatening illness, but also the crushing burden of associated costs. Costs for diagnostics, treatment, transportation, and accommodation too often become insurmountable barriers, leading to delayed diagnosis, abandoned treatment, and unimaginable loss. The support we are handing over today to KidsCan is a crucial step towards addressing these challenges. I'm told that the support will be used to procure essential drugs, facilitate accurate diagnosis, and raise awareness about childhood cancer, which are very essential as our country re-energizes the health sector to effectively deliver these services. Ladies and gentlemen, I would like to extend my gratitude to the National AIDS Council for their generous support to KidsCan. Your foresight, your flexibility, and your continued commitment to the health of our nation beyond the immediate mandate is indeed commendable. Recently, we witnessed the support you extended to Parenyatwa Hospital, whose blood and renal units you equipped with state-of-the-art equipment. You have demonstrated that the AIDS levy is a strategic national resource that is enhancing not just the response to fight HIV, but the entire continuum of care, especially at this juncture when we have lost a significant amount of financial support from our partners. To KidsCan, your passion and dedication are an inspiration. I charge you to use these resources effectively and accountably. Every dollar saved, every life touched, every smile restored on a child's face will be the true measure of this investment. The Ministry of Health stands with you as a committed partner. To the parents and guardians here with us today, and we will not rest until every child in our nation has the opportunity to lead a healthy life. Let me also take this opportunity to welcome you to the World AIDS Day commemoration, which will happen in Matabeleland South Province, deviate from Dr. Madzima from Zingwane High School. As I'm speaking to you right now, the World AIDS Day report is being launched in UNAIDS, and this is internal to UNAIDS, and we'll soon get this report such that we'll be able to publish in our various tabloids and ensure that the HIV story is not dying. HIV is still real, it is still with us. The theme for the World AIDS Day this year and going forward into 2026 is overcoming disruptions, transforming the AIDS response. And we really would wish you a Merry Christmas, and also as you come for the World AIDS Day, we wish you well, we wish you healthy. And as Dr. Madzima has already alluded to, we are inviting you to the marathon that will help us all keep fit, stay fit, and promote wellness in all our endeavors. With these few words, I thank you.
Thank you, UNAIDS. We have delivered the minister's speech. So at this point in time, Dr. Madzima, I'll ask Kaliwa to assist me. We are going to hand over the check, and I'll ask you to see this side. So I'll ask Dr. Madzima, with the assistance of Kaliwa, to hand over this check to the Minister of Health representative, and then hand it over to KidsCan. If you are done.
Yeah, so maybe just to explain, so Mr. Mackenzie, at some point will you give him one?
Yes.
Okay. Okay, that's fine.
Thank you. So, thank you, Dr. Madzima. Thank you, Mr. Manika. Thank you, Mr. Mackenzie. This is the support which National AIDS Council is given to KidsCan. National AIDS Council is given a lot of support towards national assistance. So I'm asking Mr. Mackenzie, who is the Executive Director of KidsCan, to give his remarks after this meeting, don't follow it. The money is already been transferred. It's already in their account. So, Mr. Mackenzie, you are welcome to give your remarks on behalf of Kids Camp. Yes, please. Thank you.
If I may be allowed to sit so I can give follow protocol. Thank you very much. Very good afternoon to everybody. Ladies and gentlemen, to the CEO of the National AIDS Council of Zimbabwe, Dr. Madzima, the Minister of Health and Child Care, represented here by Jeremiah Manika of UNAIDS, distinguished partners and friends, and also the media fraternity. On behalf of KidsCan Zimbabwe, allow me to express our deep appreciation for your unwavering partnership in supporting children fighting cancer in our country. The support from the National AIDS Council, very surprised at this huge amount, is not simply financial. For us, it is life-giving. It directly strengthens diagnostics, welfare support, transport assistance, food packs, counseling, but also the treatment pathways for our children. We all know and understand that cancer is a very expensive disease, more so emerging childhood cancer. And this donation makes a huge, huge, huge difference. Every child, in order for them to be treated, needs to be diagnosed. The doctors need to find out, they need to know what cancer the child has and what stage that cancer is at. We're talking of blood tests, tissue sample tests. We're talking about X-rays, CT scans, and also MRI scans. Throughout the journey of treatment in childhood cancer, the children need to have periodic diagnostic testing. So you can imagine that cost being taken away from the burden of our parents. We are truly grateful. Every year, KidsCan assist plus minus 700 children, and behind each number is a child with a dream, a family with hope, a story that deserves a chance. And your partnership has made this possible. As Zimbabwe continues advancing towards 2030 goal of ending AIDS as a public health threat, it is also important to highlight the clear intersection between HIV and childhood cancer. Children living with HIV face a significantly higher risk of developing certain cancers. I know I'm not clinical, but particularly lymphomas and Kaposi sarcoma. Beyond the HIV-associated cancers, the national burden of childhood cancer remains substantial, with just over 200 diagnosed captured annually, although we know the real figure is much higher than this due to underdiagnosis and possibly even late detection. The barriers facing children with cancer, delayed diagnosis, limited access to treatment, and psychosocial challenges mirror the challenges Zimbabwe has addressed, and I can gladly say with remarkable determination, through the HIV response. This positions us as a country to do the same for childhood cancer. One of Zimbabwe's greatest public health strengths is the solid HIV program infrastructure. Reliable laboratories, strong supply chains, trained nurses and doctors, robust data and monitoring systems, and community level structures. These assets offer an extraordinary opportunity. By leveraging HIV systems, we can significantly strengthen childhood cancer detection, diagnosis and care, improving efficiency, promoting equity, ensuring that no child is left behind. We all know that Zimbabwe, for us, is uniquely positioned on the global childhood cancer landscape. We are honored to be recognized as the fourth focus country in Africa in the WHO Global Initiative for Childhood Cancer. Furthermore, the ministry has submitted an application to join the St. Jude WHO Global Platform to Access to Childhood Cancer Medicines, a program that could transform access to essential drugs and for our children. And to prepare for such and future support, we respectfully urge the Ministry of Health and Childcare to convene a national stakeholder strategy meeting. This gathering would enable government, hospitals, partners, and civil society to map out systems, gaps, and joint mechanisms needed to absorb and maximize this potential global assistance. In addition to ensure coordination, continuity, and accountability, we also kindly ask and request the ministry to consider appointing a dedicated childhood cancer focal person. This would be critical in driving national efforts towards achieving the 60% survival target by 2030 in line with the World Health Organization. As I conclude the 25-year cycle, allow me to humbly request the National AIDS Council support to continue. Cancer does not stop. Sustained partnership will enable us to strengthen early detection, improve diagnostics, support vulnerable families, train more pediatric health workers, and build better data systems to guide national response. These children cannot speak for themselves. It is our collective responsibility to speak and act for them. And as Zimbabwe develops the next national HIV and AIDS strategic plan, we also respectfully appeal for the formal inclusion of childhood cancer in the ZANAST 5 framework for 2026-2030. Given the comorbidity between HIV and childhood cancer and the strong infrastructure already in place through the HIV program, this integration, we believe, is both strategic and necessary and fully aligned with the SDG 3, good health and well-being. By including childhood cancer in ZANAST 5, Zimbabwe would not only strengthen care for vulnerable children, but also lead the continent in demonstrating how HIV systems can support broader public health challenges. And in closing, once again, allow me to thank the Ministry of Health and Childcare, Dr. Madzima, and the National AIDS Council in particular. I know you have walked that path. You have seen the challenges in A4 ward. So we thank you for this support. I know we are receiving this check today, but this has been a partnership that has gone many years before this. Your leadership, commitment, and compassion give our children with cancer the greatest gift, a chance to live. So today, Kids Can remains fully committed to working hand in hand with you. And as we strive for a future where every child diagnosed with cancer in Zimbabwe receives timely, dignified, and life-saving care. Thank
you. Thank you, Mr. Mackenzie, for those remarks. Mr. Mackenzie's story won't be complete without hearing the side of the beneficiary. We apologize, not apologize really. We could not blame the kids who have benefited because of their rights. So we are going to invite one of their caregivers just to make it short. so that we hear the support which has been extended. She's going to talk on behalf of the kids who have received support from National Council.
Good afternoon. My name is Maitino. On behalf of all the parents, the kids affected, I would like to say thank you to NAC. We smile today because of partners like you. You are partners in our low moments, and we appreciate you. Partners who hold our hands in moments hard to describe. In painful trying times, you help us shoulder our burdens by lighting with them. On behalf of the parents and guardians of children affected by cancer, I would like to say thank you for your evening.
Thank you. Thank you, kids can take leave. Dr. Matsima, allow me at this point in time to invite a few questions for members of the media throughout this day, which have been announced. So, if there are any questions, I will give you this opportunity to ask. Thank you for breaking my ice. You can introduce yourself.
Good morning, colleagues. Good afternoon. I'm Shabin Mohammed. I'm a reporter with Nature and Men. I would be concerned to hear or to learn about nutrition, especially in people living with HIV. Many families with HIV, they are saying hunger is now their biggest barrier to staying on treatment. What immediate relief or livelihood support can they expect from NAC, especially around this season?
Okay, thank you. I'll take another one if it's there. Okay, you can come. You can come up here. You can come up. I'll take another one. Is there another one? Another question? You can come here. Is there another question? I'll take another question. No. So, Dr. Matsima, those are two questions.
Okay. So thank you. Let me thank the remarks from Kids Kane and also from the guest of honor. But also let me thank the colleagues, the journalists who have asked the questions regarding, the first one is regarding nutrition in terms of the HIV program. Yes, I think we are all aware that issues of nutrition play a big part, not only in people who are HIV positive, but in the general population. And under the Ministry of Health, and under certain ministries, there are programs regarding nutrition. I would say before the advent of proper treatment like ARVs, National Health Council really was at the forefront of nutrition programs, leading CBOs to establish nutrition gardens in the communities and everywhere. And this work did not stop. There are organizations which are supported of people living with HIV, which carry out these programs of nutrition gardens and proper nutrition. But for National Health Council, what we've tried to do at the moment, the programs which we're involved in, which regard nutrition, are mainly to do with the inmates, the people in prisons. We have got a collaboration with the Zimbabwe Prisons and Correctional Services, where we support them with nutrition for the inmates. I can tell you that, for example, at Wawa Prison, we have a pig rearing project. In Matabeleland South, we have a goat rearing scheme. In Bindura, we have got a vegetable. We do gardens there with the prisons, the ZPCS. So it's our way of trying to say nutrition is important, but we cannot go out and then, support every aspect of nutrition. We can only do it maybe in a technical way, but in terms of providing resources for nutrition programs, the active one is with the prisons. But we also support Embuchen Hospital with their garden and their chicken project. So it's a way of acknowledging that it's important to have proper nutrition, but this is not confined to HIV positive, people living with HIV only. It's every Zimbabwean should ensure that we should ensure that they get proper nutrition. Then coming to the second issue, but my colleague, if he wears his other hat as UNAIDS, he can also come in. But lenacapavir, which is the drug which we've talked about, it's not the first injectable, but it's only that this one is given once every 6 months, which is twice a year. But before that, we had cabotegravir, which was being given once every 2 months. So the injectables is a way of prevention treatment. They've come over the past few years. And I think you saw in the media that last week Zimbabwe registered LENCAP under with Medicine Control Authority of Zimbabwe. So it's now registered in Zimbabwe. It was fast tracked, but the evidence is there that it works and it's effective. But the other thing I need to clarify is that if it's going to be a national program, it's for the at-risk population, those who are at risk. And here we're talking about our usual, what we call key populations. Those are the ones, if we're going to have a national program, because it's not like it's cheap. It's not cheap. So you really want to target those at-risk groups which still have a high prevalence and high incidence, new cases of HIV. An example would be pregnant women. You want pregnant women to, as part of the prevention of mother-to-child transmission. Sex workers, those will be groups which we want to target if you're going to have a national program. But if at individual level, someone can afford to go and buy it, then I'm sure they can access it through their doctors or through the hospitals. I don't know, Jane, whether you want to add something.
Thank you, Dr. Matima. I think you have covered quite a lot on that. Just to add on to the work that NAC is doing in terms of supporting nutrition, that NAC is not alone in that. As you know, within the UN, we have the WFP, the World Food Programme. We have worked together to integrate within their vulnerability assessment HIV and other vulnerabilities that bring HIV into families in those vulnerability assessments. So whenever WFP is sort of giving their cash handouts, giving food, they are also considering people living with HIV. They are also considering the vulnerabilities that bring in HIV, and they are also even distributing condoms in those food distribution centers. So I just thought I should add on to say a lot is also happening with the partners of the UN Joint Team. On the lenacapavir, I think he has covered it. We have advocated for land which comes in cheaper, but as a national program. So I think that one. Thank you.
Thank you, Dr. Matima. Thank you, Mr. Manika. Your responses have also caused other questions to come on board. So I'll take Kwaeza, I'll take NRTV for the questions in the back.
Ndinoda kubvunza kuti this new drug inonzi ichaita chimuka and we got out the papers kuti vatenze Kwaeza. Ndada kubvunza kuti this new drug harizoite here nhaikire matambudziko ekuti vanhu vanenge vakutengeserwa mumastreets umu issue yemacounterfeit drugs. How are you going to kill mastudents ivavo bcause vanhu vakabva kune imwe drug inozonzwa dhara kutengesa mumakona mikoto mukoto. Then issue yevulnerability neaccess. Tada kunzwa kuti vanhu vataziva kuti drug inombotengeswa mari ndekuti kwatirori mwana vezve inokwanisa kukatiwa here inomanagwa AIDS.
My name is Dorcas Mkhize from NRC. My question is the disruptions that are highlighted on the theme. Okay. Okay, the theme is highlighting of overcoming disruptions. Which ones have we already overcome, and which ones are we looking forward to overcome as we approach the 2030 target?
Thank you for those questions. So with these two questions, I will then close the question and answer session. Dr. Mazima and Mr. Malika, I know that some of the journalists would want to ask you privately the other questions. So you have an opportunity to meet him after this meeting, outside this meeting. Thank you.
Okay, thank you, Master of Ceremony, and thank you to the colleagues who have asked the questions. The first one is on counterfeit drugs and the new drug which has come and how it's going to impact or to affect. So again, the issue of counterfeit drugs is beyond the land cap. As a country, it's something which we should be seized with. And I understand that at ministry level, at NATFAM level, they are trying to put trackers and everything to make sure that the drugs which are out there are authentic. But it goes beyond the National Health Council, beyond the ARV drug. This drug, it's one of the ARVs which have already always been there. So we always try and make sure that the distribution of drugs of national importance they are readily available in the public sector. I think that's one way you can curb, demand in the private sector or in the, what do you call it, in the streets. So availability, we want to ensure availability of the drug, and then you also ask about access and vulnerability and everything. Like I said, this drug was only registered last week, although work has already started, and we had carbon before using also an injectable. These are things we should have just tried to put in place, the systems to try and first of all, you to identify the people who are at risk, and then who do they work with, and putting all those structures, the training materials for the health workers, the supply chain and everything. So it will be part of the supply chain of all the drugs which come via NATFAM to the hospitals. Yeah, so I would say that it will just join the supply chain of any other drug. And we'll make sure that those who need it really get it. In terms of affordability, like what Jerry has said, if it comes as a national program, then we either it's ourselves as government or as our usual partners to make sure that it's affordable. People get it at an affordable, whether they're buying or it's given for free, just like the other ARVs. Then the issue of disruptions, as the theme says, the theme came from UNAIDS, and I'll ask Jeremy to talk about disruptions. But yes, there have been disruptions, and that theme there, I think the people who at UNAIDS who thought about it, they're looking at the disruptions which have happened, with the funding disruptions, but also with issues which have happened over the past 5 years or so, other emerging health issues like COVID, with disruptions. We now have NCDs as a public health threat. So I'm sure that has been the thinking behind it. How do we overcome those disruptions which threaten the HIV, the goals or the ambitions of the HIV response? But I'll ask my colleague maybe to address that.
Thank you, Dr. Martina. Yeah, indeed, the world has suffered a number of disruptions, and most particularly here in Sub-Saharan Africa, where we are the hardest hit in terms of HIV and AIDS. I think you have seen changes in the funding architecture, where the US government and other Western funders have really changed their focus and priorities. So that has really affected how countries are going to respond to the HIV response, given those disruptions. The question was asking which ones we have overcome and which ones are still to be addressed. I think really it's a difficult question, given that the disruptions cut across board. It cuts across all HIV programs, prevention, care, treatment and support, and therefore really the disruptions are just too many. But what I can say is that we have worked together with Ministry of Health and National Health Council to develop what we call the minimum service package, which is a product of consultations with all stakeholders to see what we can sustain with the resources available. So that minimum service package is sort of a guiding tool to ensure that people who are living with HIV will continue on treatment. People who are at risk of HIV infection will continue getting HIV prevention services. So no program will be left out, at least according to that minimum service package. We will try to ensure that we target the communities with the requisite services so that we end AIDS-related deaths and also we end HIV new infection. Let me also hasten to mention that we are in the process of developing the ZINASP 5. It's also an opportune moment to look at what has been disrupted, how do we end 2025, and how do we start on a new slate 2026 until 2031 to see what we can prioritize. So the ZINASP is an opportune moment, which will also invite you to share your thoughts, to also get counted in terms of what we consider as priority going forward. So yeah, thank you.
Thank you, Mr. Manuka, for that response. At this point in time, Dr. Mazima, who is the NACCIO, allow me to close this meeting. For those who have questions, we are always open for the questions and you can use. So, for those who have questions, we are always open through all our channels if you have further questions. So, Dr. Mazima, allow me to close this meeting. I would like to thank the media, the AIDS organizations who have come, and also special mention to the people with disability who have been giving us the services of the sign language. It shows us that we are living no one behind. It's an inclusive response to HIV and AIDS. Thank you.
Yo, we can.